Stop scrolling this minute could save your life. Imagine waking up tomorrow knowing you caught prostate cancer before it had any chance to spread. Sounds impossible, it isn't, but only if you recognize the warning lights your body is flashing right now. Most guys miss them because they seem harmless. A midnight bathroom trip here, a weak stream there, an ache you blame on yard work. Today, we're counting down 7 early signs. Your prostate may be in real trouble starting at number 7 and finishing with the most critical red flag at number 1. For each sign, I'll show you what it means, why it happens, and the one step you can take tonight to get ahead of it. Grab a notepad and stay locked in, because ignoring one of these clues could turn an office visit into surgery. We'll break down urinary changes, hidden pain, and bedroom signals most doctors hear too late. Stay tuned for a 1-minute self-check you can do at home with just a watch and water. By the end, you'll have a plan to discuss with your doctor and the confidence to act first. Your clock is ticking, so pay close attention right now. Let's dive in. What if catching one tiny symptom early could be the reason you live 20 years longer? That's not an exaggeration when it comes to prostate cancer. Early detection truly saves lives. The problem is, most men don't notice anything is wrong until it's already serious. Why? Because prostate cancer often starts quietly. A little fatigue, a weaker stream, a bit more urgency at night. Easy to dismiss, easy to ignore. But those subtle shifts, they're the first whispers of something much bigger. And the sooner you catch them, the more options you have. More treatments, less pain, higher survival rates. The 5-year survival rate for early-stage prostate cancer is nearly 100%. But once it spreads, that number drops fast. That's why every man over 50 or earlier, if you have a family history, needs to know these 7 signs. Not to scare you, but to prepare you. In this video, we're not just listing symptoms, we're giving you a roadmap, a way to listen to your body before it screams. So if you've been brushing things off as just getting older, it's time to stop. Because when it comes to prostate cancer, waiting is the real danger. Let's get into the signs starting with number 7. Here's something most men ignore until it's too late. Frequent urinary tract infections or difficulty urinating. You might think, that's just age or I drank too much coffee. But here's the truth. Recurring urinary issues are often the first red flag your prostate is under attack. If you're getting UTIs more than once or twice a year, or struggling to fully empty your bladder, you need to pay attention. These aren't just annoying inconveniences. They may be early signs of something far more dangerous. Here's why an enlarged or inflamed prostate can block the flow of urine, making it harder to empty your bladder. When urine lingers, bacteria have time to grow. That's why UTIs start coming back again and again. You might feel a burning sensation, notice cloudy or foul-smelling urine, or constantly feel the urge to go even if nothing comes out. And let's talk about the flow. Has it become weak or hesitant? Are you straining to get started or stopping and starting midstream? That's not just your plumbing slowing down, it could be your prostate pressing on your urethra. The real danger is in dismissing these symptoms as just part of getting older. Because while you wait, your prostate could be changing in ways that lead to cancer or a complete urinary blockage that lands you in the ER. So what should you do? Start keeping track. Log how often you're going any discomfort and when symptoms flare. That small habit could give your doctor the insight needed to catch something early when it's still treatable. Don't wait for things to get worse. Catch the signs now and you stay in control. Let's move to warning sign number 6. Ever felt like you're squeezing a garden hose that just won't cooperate? That's exactly what a weak or interrupted urine flow feels like. And it's sign number 6 on our list, because it's one of the clearest signals your prostate is starting to clamp down on your urethra. Picture the prostate as a ring around a straw. When that ring swells or grows irregular tissue, the straw narrows. Suddenly, your once steady stream turns into a drip-drop struggle, or worse, starts and stops like a faucet with air in the line. Most guys brush this off. I'm just getting older. Maybe I didn't drink enough water. But here's the hook. abnormal flow isn't a water intake problem. It's a plumbing problem inside your body. A healthy bladder muscle should empty in one smooth push. When you have to strain, pause, or wait to restart, your bladder is fighting back pressure from a prostate that may be inflamed, enlarged, or developing early cancerous changes. Over time, that back pressure can actually weaken the bladder wall, leading to infection stones or complete retention, an emergency no one wants. So how do you know when slow is too slow? Time yourself. A normal bladder empties 8 to 12 fluid ounces in roughly 20-30 seconds. If you're standing there longer, forcing out dribbles or hearing that stop and start splash log it, keep notes for a week, morning, afternoon, night. Then bring that record to your doctor. Those numbers turn guesswork into hard data. And let your urologist run the right tests early, not after complications set in. Remember, the sooner you catch a squeezing prostate, the wider your treatment options, ranging from simple lifestyle tweaks to minimally invasive procedures that restore flow fast. Ignoring a weak stream today could mean a catheter tomorrow. Don't give cancer or severe BPH the running start. Track it, talk about it, and stay with us, because sign number 5 is the nightly wake-up call. You definitely shouldn't ignore. Are you waking up once, twice, maybe even 3 times a night to pee? That's not just poor sleep, it's your prostate trying to get your attention. Sign number 5 on our list is increased urgency to urinate, especially at night, and it's one of the most common early warnings that something's wrong with your urinary system. Let's break it down. When the prostate begins to enlarge or become inflamed, it presses against the bladder and urethra. That added pressure makes your bladder think it's full, even when it's not. The result? That sudden annoying urge to go, and go, and go again. But here's the real danger. Most men dismiss this symptom as a normal part of aging. Just my bladder getting older, they say. Wrong. Nocturia, waking up to urinate, can be a sign of BPH, benign prostatic hyperplasia inflammation, or even early prostate cancer. And over time, it does more than disturb your sleep. It disrupts your immune system, drains your energy, and increases your risk of falls and fractures, especially in older adults, waking up in the dark multiple times a night. So what should you do? Start tracking your bathroom trips. Write down how many times you go after 9 p.m. and if you're urinating large volumes, or just a few drops. Is it urgency? Is it discomfort? That log can help your doctor determine whether it's prostate-related bladder dysfunction or something more serious. Remember, your body's not waking you up for no reason. That 2:00 a.m. dash might be the earliest warning you'll ever get. Pay attention now, and you could protect your prostate before it causes bigger trouble down the line. And don't go anywhere. We're about to talk about a symptom that's impossible to ignore: blood in your urine or semen. There's one symptom no man wants to see, but absolutely must not ignore: blood in your urine or semen. That splash of pink in the toilet bowl, or a streak in what should be clear, can send a chill down your spine. And for good reason. This is sign number 4, and it's one of the most alarming red flags your body can send about your prostate health. While blood in urine or semen can have multiple causes like infections, kidney stones, or even vigorous activity, when it shows up repeatedly or without explanation, it demands immediate attention. Here's what's happening as the prostate enlarges, becomes inflamed, or develops abnormal growths. It can disturb the fragile blood vessels nearby. These tiny breaks lead to blood leaking into the urinary tract or reproductive fluids. In some cases, this may be due to benign conditions, but in others, especially when paired with other urinary symptoms, it could be an early sign of prostate cancer. And don't assume you'll feel pain. Many men see blood once, panic, and then do nothing when it disappears. But even painless hematuria blood in urine is a serious diagnostic clue. That fleeting symptom may be the only chance you get to catch something early. So here's the bottom line: if you see blood, don't wait to see if it happens again. Document the time, color, and any accompanying symptoms. Was there burning, weak flow pain in the pelvis or back? Bring that information straight to your doctor. It can fast-track critical imaging and lab work that might uncover prostate changes before they escalate. You only get one first warning. Don't miss it. And now let's move on to a signal many men confuse with aging or injury-persistent pain in the lower back hips or pelvis. You'll want to hear this. Nagging ache in your lower back hips that feel bruised for no reason, a dull pressure deep in your pelvis that just won't quit. That's not just getting older. It's warning sign number 3, persistent pain or discomfort in the lower back hips or pelvic area, and it could be your prostate waving a red flag. Think of the prostate's location tucked directly beneath the bladder, nestled against muscles, nerves and bones that frame your pelvis. When the gland becomes inflamed, enlarged, or develops early tumors, it can press on nearby nerves and radiate pain to places you wouldn't expect. Here's the hook, because the pain often masquerades as muscle strain or arthritis. Most men pop an ibuprofen, shrug it off, and keep going. Meanwhile, abnormal cells can quietly grow. Pay attention to patterns. Is the ache steady for weeks rather than days? Does it worsen when you sit for long stretches, but ease when you stand? Does it pair with urinary issues we covered earlier, like weak flow or nighttime urgency? These combinations matter. Start a simple log. Note the time of day, pain level 1 to 10, and what aggravates or eases it. Maybe a heating pad helps, but lifting groceries makes it spike. Bring that record to your physician. It transforms a vague complaint into actionable data that can fast-track imaging like MRI and PSA testing. Remember, early detection of metastasis or stopping it before it begins could mean the difference between outpatient therapy and complex surgery. Don't ignore pain that refuses to leave. It's your body asking for attention, not sympathy. Address it now, and you keep options on the table. Up next, we tackle a symptom men find hardest to discuss, but absolutely must: erectile dysfunction and why it can be a silent prostate alarm. Suddenly, finding the on switch doesn't work like it used to. That shock, especially if it comes out of nowhere, could be more than stress or a bad night's sleep. Erectile dysfunction ED that appears suddenly or without an obvious cause is warning sign number 2, because the same blood vessels and nerves that power an erection also run past the prostate. When the gland becomes inflamed, enlarged, or riddled with microscopic tumors, it can choke both blood flow and nerve signals, turning a once reliable reaction into a frustrating blank. Here's the kicker. Too many men chalk sudden ED up to age guilt or relationship stress. They buy over-the-counter pills or quietly avoid intimacy, never realizing their prostate may be behind the curtain. Studies show men newly diagnosed with prostate cancer often report unexplained ED in the months or even years prior to detection. That makes every unexpected failure a potential early clue. So what should you do? First, rule out the obvious medications, excessive alcohol, or unmanaged diabetes. If none apply, log the details. How sudden was the change? Are you also waking up at night to urinate? Feeling pelvic pressure or lower back pain? Sign number 3, patterns matter. Bring that log to your doctor. A PSA blood test and digital rectal exam take minutes and can reveal hidden prostate changes before they spread. And remember, addressing ED isn't just about regaining intimacy, it's about protecting your overall health. The sooner you pinpoint the cause, the more treatment options, both for sexual function and for prostate disease, you keep on the table. Ignore it, and you risk letting a silent condition advance unchecked. Stay with us, because our final warning sign number 1 exposes the most critical pain signal men dismiss every day. Here's the ultimate red flag: persistent, unexplained pelvic pain you cannot shake. We're not talking about the occasional twinge after overdoing yard work. This is a deep, nagging ache that lingers for weeks, sometimes radiating into your lower back groin, or even the tops of your thighs. You pop ibuprofen, you stretch, you rest, and it's still there, humming like a low engine. That's why it sits at number 1 on our list, because chronic pelvic pain is often the very first symptom men recall once a prostate cancer diagnosis comes to light. Why does it happen? Your prostate sits at the crossroads of nerves, lymph nodes, and blood vessels. When abnormal cells grow, or when significant inflammation sets in, They create pressure that your brain interprets as pain. At first, the discomfort is easy to blame on aging hips, sciatica, or a pulled muscle. But unlike a strained hamstring, this pain doesn't fade. It may even intensify when you sit for long periods or lift something as light as a grocery bag. Here's the critical takeaway: duration matters. If pelvic pain lasts more than 2 weeks with no clear cause, document it. Note the time of day intensity on a 1-10 scale and any activities that worsen or relieve it. Pair that diary with any other signs we've discussed, weak flow urgency, or blood in urine, and take it straight to your doctor. Those details can trigger early imaging PSA testing or a biopsy steps that could uncover cancer while it's still local and highly treatable. Ignoring persistent pelvic pain is like silencing a smoke alarm by removing the batteries. The fire still burns. Listen to your body's loudest warning and act now, because confronting pain today could save your health, your independence, and your life tomorrow. What if your body's been whispering a warning every day and you just didn't know how to listen? That's exactly why proactive monitoring isn't just recommended, it's essential. Prostate cancer doesn't start with a bang. It begins with subtle changes. A weaker stream, a midnight bathroom, run a strange ache in your hips. On their own, these might seem harmless. Together, they can tell a story your doctor needs to hear before things get serious. The problem: most men wait until the symptoms are loud, when the treatment options are fewer and the outcomes less favorable. But by tracking symptoms early, keeping a log of pain, urinary patterns, or sexual function changes you're giving your physician the clearest map to intervene quickly and effectively. Start simple jot notes in your phone, or better yet, use a prostate health app designed for men over 50. Combine this with routine PSA tests and physical checkups, especially if you've experienced any signs we've discussed today. You don't need to be a doctor to spot trouble, you just need to pay attention. Remember, early action beats late regret. Proactive monitoring gives you control, protects your quality of life, and might just save it. Let's face it, nothing is more terrifying than the unknown. That's why, when it comes to prostate cancer, knowledge isn't just power, it's peace of mind. Too many men suffer in silence, brushing off signs, or waiting for things to get bad enough to seek help. But fear grows in the dark. The moment you learn what to watch for, what's normal, what's not, you take back control. Understanding your symptoms, knowing your risks, and staying informed doesn't just help your doctor, it empowers you emotionally. It replaces panic with a plan. Instead of lying awake at night wondering, you'll have clear next steps, what to track, what to ask, when to act. This video isn't just about physical health, it's about confidence, clarity, and courage. Because the more you know about your prostate, the stronger you are, mentally, emotionally, and physically. Don't wait for fear to find you. Fight it with knowledge. If this video opened your eyes even a little, don't keep it to yourself. Prostate cancer doesn't just affect one man. It touches families, marriages, friendships, and entire communities. That's why your next step matters. Share this video with your father, your brother, your neighbor, any man you care about. You might be the reason they catch something early. Better yet, drop a comment below. Share your experience, your questions, your fears. You're not alone, and your story could help someone else feel less afraid to speak up. And if you haven't yet hit that subscribe button, join a growing community of men who refuse to be caught off guard, who believe in prevention knowledge and support. Because when we speak up, we lift each other. Together, we break the silence around men's health, and we save lives. Don't wait. Take action. Be the reason someone lives longer, stronger, and more informed.